us.
Yes, good morning, everybody. Thank you so much for joining us at the RDI conference, Pathways Through Disruption. This session number 52, is Individual Papers, Feminist Practice as a Pathway to Sustainable Development. I would firstly like to introduce Anita Alford, Wang, Jing, and Tiffany Angelopoulos. These three ladies work at Fred Hollows Foundation, and I will introduce each of them individually, and then they'll be speaking for approximately 15 minutes, and we'll go from there. So just bear with me because my screen is playing up. One moment. Okay. Oops. We might actually just get started, sorry, with the ladies from Fred Hollows, Feminist Pathways, and we'll go from there. Thank you.
Thanks, Vivian. I will just share my screen. Okay, is that in slideshow? Okay, so hi, my name's Anita Alford. I'm the Senior Equity and Inclusion Advisor here at the Fred Hollows Foundation. And today with myself and my colleagues, we'll be presenting on our work on taking a gender transformative approach to our eye health programming with a focus on developing, implementing and evaluating gender equitable eye health training materials for eye health personnel in China, Kenya, Nepal and Ethiopia. So I'd like to acknowledge the traditional owners and custodians of the land of which we work and recognise their continuing connection to land, waters and community. I'm on Rachael land up here in Darwin, and my colleague Tiffany is on the land of the Wurundjeri people of the Kulin Nation. We pay our respects to them and their cultures, their elders past, present and emerging. So as I said, today I'll be presenting with Wang Ji and Tiffany Angelopoulos, but I'd also like to acknowledge our co-contributors to this presentation, Angela Dalha, Sarah Ola, Emma Bet Angia and Ming Ni, who all work at the Fred Hollows Foundation as well. So to start, I just want to talk about gender equity and eye health. Global statistics have shown us that women have higher rates of blindness and avoidable blindness than men, and most live in low and middle income countries. In most of the countries where the Fred Hollows Foundation works, women are less likely to access services than men. These includes women in rural area, women with a disability or from an ethnic minority group or Indigenous people. These inequities intersect with gender to create barriers for women to access eye health services. Eliminating inequities in eye health contribute to the Sustainable Development Goals, notably number 10 and 5, and also contribute towards universal health coverage. Gender equity is not only an issue for accessing eye health services, but also within the eye health workforce. The COVID-19 pandemic has amplified inequities, and this includes within the health workforce. Global studies have reported that the health workforce is made up of 70% women, but that women only hold approximately 20% of those decision-making positions. We have limited evidence within the eye health workforce, but we assume similar situation, and that has definitely been the case in the countries where we've conducted this gender equity training with our partners. So 4 years ago, training materials were requested from our country teams. And these materials were to work with partners on gender equity, both within the eye health workforce and to work on gender equity within our eye health services. The aim of developing these gender equity materials was to increase gender awareness amongst partners and to create a space that they can begin a dialogue around supporting female staff to enter leadership positions. The way we developed these materials was a co-design process, which included representatives from all our country teams. We came together before COVID and we could travel, and some of our partners were involved as well. So we worked together to design and pilot the materials. The intent was that these materials were to develop a generic manual that could then be contextualised by either a local consultant or by the country team to ensure the materials were fit for purpose for the local context. The training program was evaluated using the Kilpatrick Evaluation methodology, which looks at 4 levels of change: reaction, learning, behaviour and results. We use post and pre-surveys to measure the reaction and the learning immediately after the training. And then in intervals of 1 month to 1 year, we followed up with participants to see if there were any changes in their behaviour after being part of the training, and overall results if there had been any changes in their organisation to make it a more equitable workplace. The evaluation was also used as a touch point for partners to remind them that their action plans that were developed during the training, to see how they were implementing them and see what support they needed. Much of the data from the evaluation was qualitative, and we were able to hear some great reflections on the training, such as the quote from a participant in Ethiopia that are there on the screen. I'm more inspired to look inward, challenge myself to tackle the deep-rooted gender-related bias in order to address gender inequality, both in personal and workplace circumstances. I will now pass over to my colleague Wang to give a deep dive into the work in China.
Thank you, Anita. Next slide, please. So the purpose of this project is to integrate gender equity in eye health care in rural area of China. The approaches we take including gender equity training materials, locally contextualized, and by using the training materials, we did the trainings for 4 kinds of participants groups, including eye health care personnel, community health workers, primary school teachers, and Women's Federation staff at the primary level. And based on our gender-based CAP survey, we developed gender-sensitive AEC materials for gender equity eye health education. And with these approaches, one of the highlights is involvement of local Women's Federation. The Women's Federation is a government body in China that is responsible for rights and the well-being of women and children. And it is very important to get the eye health sector and the Women's Federation work together on eye health. And to measure the impact of gender equity eye health training, we carried out a case study by using the Kilpatrick Evaluation method that my colleague Anita just mentioned. Next slide, please. And these are the major results and outcome from approaches we tried. First is a Chinese localized training manual and a set of gender-sensitive AEC materials to educate local community people. And you can see these materials on the slides, the pictures. And from evaluation of the training of the 4 kinds of participants, including Women's Federation at community level, both knowledge and awareness of gender equity in eye health increased. And at each training, at the end of each training, action plans developed. The participants are aware specific need of women and girls and will be providing special needs or aid as necessary. Next slide, please. And we learned a few lessons from this program. First of all, we took no harm approach when we work with government stakeholders by demonstrating that we are not confronting their gender work, but we are trying to minimize barriers for women and girls to access eye health care. Secondly, we get a local partner fully involved from beginning to the end in this process. For actions, for improvement, in the future, we start from simple, practical, and basics that easily for partner to follow up. And for the future actions, what we will do, we will provide refreshment training for healthcare workers to be able to train more community eye health workers and Women's Federation staff. And we will include training sessions that specifically for the management staff, our local partner, to make changes at the management level beyond the service level. And we will include gender-specific indicators into eye health interventions to measure the effectiveness of gender approaches. And finally, we will integrate gender equity eye health training into other projects of the Fred Hollows Foundation China program for wider impact of gender equity in eye health. Thank you for listening. I will head over to my colleague, Tiffany Angelopoulos, excuse me, for more experience we have with the other country of the foundation and the findings we get from this process. Thank you.
Thanks, Wang, and thank you, Anita. Overall, the findings showed that participants of the training were able to reassess their own biases around gender equity. Following the training, participants agreed that there is an underrepresentation of women in leadership positions within their workplaces and communities. Lack of gender awareness from other staff, including management, was a barrier that prevented a lot of action plan items from being achieved. Many participants felt that it would be beneficial to extend the training to those in leadership positions. Next slide, please. So in Nepal, all levels of decision makers from partner hospitals were present for the training. This helped progress training outcomes as everyone had the same background information around gender equity, removing barriers that might have delayed action plan items. Female staff also felt more comfortable speaking out in meetings after the training, but still feel that they are unable to make key decisions. Partner hospital staff in Ethiopia gained a better understanding of how to interact with female patients, the importance of health promotion, especially when reaching women, and the need to prioritise patients' individual needs. The theme of appropriate and equitable patient interaction was reflected in all country reports as a key learning from participants, highlighting the impact of the training's efforts to inform staff on the social determinants that may hinder a woman's ability to access eye health treatment and what they can do to remove these barriers. Kenya had disability inclusion integrated into the training. This helped participants understand how the intersectional nature of disability and gender can compound a person's disadvantage. At the conclusion of the training, the community-based organisation participants, CBOs, recognised their influential role within their communities and were eager to share their learnings around gender equity and disability inclusion. Multi-sectoral partner training showed its advantage in this case, as CBOs have higher outreach and can impact a lot of regional and remote communities in a way hospital staff cannot. Next slide, please. The gender equity transformative approach aims to generate an environment of equal opportunity for women to access eye health services. However, the training is also able to introduce a dialogue around the benefits partners have when institutional discrimination is removed for women in the workplace, which can allow for equal career and leadership opportunities. Next slide. Thank you. And finally, the effects of COVID-19 were felt during the implementation and evaluation process of this training. Despite the challenges of COVID, the program was not only completed, but it highlighted the unequal effects that COVID has on gender, both in terms of patient access to services and within the workforce. The foundation is supporting partners enact their action plans, facilitating the extension of the training to partners, and will work on continually transferring the lessons learned from this training to key stakeholders. Thank you very much for listening to our presentation, and we look forward to your questions.
Thank you so much, Tiffany. Before I introduce the next speaker, I would like to officially introduce the last three panelists that we've just heard from the Fred Hollows Foundation. Anita Alford, who is a Senior Equity and Inclusion Advisor for the Fred Hollows Foundation, Anita has worked in a variety of international and national NGOs in the Asia, Africa, and the Pacific regions, with a focus on gender equity and women's empowerment. Wang Jing is a senior project officer for the Fred Hollows Foundation China program, as you heard. Wang has worked on public health issues with a few local NGOs in China and China program with a few international NGOs with a focus on mobilization of vulnerable communities. And lastly, we just heard from Tiffany, who was a Masters of Public Health student at the University of Melbourne, where she majored in global health and evaluation and implementation science. She is completing an internship at the Fred Hollows Foundation with the research team and has previously worked with the gender equity and inclusion team at the foundation. Thank you so much, all three of you, for a fascinating insight into the areas of your work. I would like to now introduce Alice Rich. Alice is a Senior Research Policy and Advocacy Advisor at the International Women's Development Agency. Thanks, Alice.
Thanks so much, Vivian. I'm going to share my screen by clicking the right button, and hopefully you're seeing my presentation now. So thanks so much for having me. I'd like to also acknowledge that I'm joining you from Wurundjeri country on the lands of the Kulin Nation, and pay my respects to elders past and present, acknowledging that sovereignty was never ceded and this always was and always will be Aboriginal land. So it's been 7 years now since Sweden announced the first officially feminist foreign policy back in 2014. Since then, several other countries have joined the mix. 4 years ago, we saw the first feminist international development policy announced by Canada. In 2019, we had France and Luxembourg, followed by the first country from the global south to adopt a feminist foreign policy, Mexico, in 2020. Also in 2020, Canada committed to upgrade their aid policy into a full feminist foreign policy, and Spain also announced their intention to develop a policy. And just this week, in fact, I believe overnight, Libya announced their commitment to develop a feminist foreign policy as well. But what actually is a feminist foreign policy? So part of the issue here is that there is no globally agreed definition. And often when people talk about feminist foreign policy, they bring their own assumptions into the mix. A big one is that often people talk about the importance of women holding leadership roles in the foreign policy sector. This is obviously really important in its own right, but it's not enough to guarantee feminist policy making. So if it's about more than representation of women, what's in the mix? We've done a few pieces of work on this at IWDA over the past few years, which I won't go into in detail, but the things I want to draw out are that feminist foreign policy has to put gender as the central goal of foreign policy. And it needs to mainstream a gender lens across all areas of work, including defense, trade, diplomacy, and development. So that's often called the twin track approach. It needs to be rights-based, intersectional, and power disrupting. And it needs to be backed up by resourcing and accountability mechanisms. A shorthand that I like to use for this is that if you don't have to change anything about your foreign policy to make it feminist, you're probably not really doing it. You're probably just putting on the label and not really implementing it in practice. So IWDA has been advocating for Australia to adopt a feminist foreign policy for a number of years now. And as more and more countries go down this path, we wanted to understand more about the factors that have enabled these outcomes and what they might be able to tell us about our own context. So that brings me to the research that I'm presenting today, which is a project that we commenced last year to try and find out what's worked in these other contexts. What are the pathways that other countries have taken in adopting feminist foreign policies? And in doing this, we wanted to create a resource for ourselves and for others that would inform advocacy towards feminist foreign policies around the world, which I'm really thrilled to say that we launched earlier this week. I've also included our research team on the slide here. Liz Gill-Atkinson, who took the lead on this project and really did the lion's share of early mornings, late night interviews with people all around the world, and really brought a strong academic rigor to our research process. I also want to acknowledge Camille Warenberg and Tamara Peña-Porras, who are members or former members of our team at IWDA, but who are native French and Spanish speakers, which enabled us to conduct interviews in those languages, which really was a fantastic way to extend the reach of our research into feminist foreign policy and bring in some of those findings from those countries around the world. So to run you through our methodology, we adopted a qualitative research process aligned to IWDA's feminist research framework, which is a framework that helps us design research to be feminist, accountable, collaborative, and transformative in line with our organizational values. We did a literature review, reviewing the existing literature on feminist foreign policy, particularly on those sort of pathways to adoption. And we conducted in-depth interviews with stakeholders across civil society, academia, and government who bring specific knowledge of the countries which have adopted feminist foreign policies. So we spoke to 29 people across 9 countries, and as I mentioned, in 3 languages. These interviewees then engaged with us in a participatory data validation process to help sort of deepen our analysis and findings. In terms of limitations, a significant one is that we weren't able to really get any detailed information or contacts on Luxembourg. This was consistent with everyone we talked to. Really, no one had much more information beyond the quote that I've put up on the screen, which was part of a foreign policy address in 2019. So it's unclear the extent to which Luxembourg have really implemented that commitment. And for that reason, we haven't included them in our research findings. Spain and now Libya announced their feminist foreign policies after we conducted interviews, so they're not included in this research. Canada's an interesting case because they began, as I mentioned, with a feminist aid program policy and have now expanded that to a feminist foreign policy, which is a process that's still underway. So we've captured data on both of those policies. We've also included some information on the experience in the UK. They don't have a feminist aid policy, but the Labor Party there took it to the 2019 election as part of their platform. Obviously, they were unsuccessful in winning that election, so it didn't become government policy. And we determined that there are too many factors at play there. It's a little bit complicated to, certainly we kind of attribute the loss of that election to their feminist foreign policy platform. So where we've included the UK, it's really speaking to the motivations of the particular minister who championed that policy, as speaking to sort of the broader factors that influence politicians to take up these policies rather than the fact of getting them in place. The other really big limitation that I want to mention is that this research is quite intentionally focused only on the pathways to adoption of feminist foreign policies. We're not trying to make an assessment here of the impact that those policies have in the world. We'd really love to do that research at some stage. I think it's a critical question to answer, you know, do these policies actually change anything for women, particularly women in the global south? Obviously, that's a big piece of work, which would require some funding, which I'm just throwing out into the world. And we'd really love to do it, but it's not the focus of this project here. Okay, so in terms of the research findings, there's a few categories of findings, and the first is around the factors behind declaration of feminist foreign policy commitments. So what we found is that all the policies we looked at came as surprise announcements, particularly to civil society, but even sometimes to people working within the foreign policy bureaucracy or other parts of government. In most cases, it was really a minister or a prime minister going out on a limb and making an announcement, even to the surprise of their colleagues. So as you can see on the slides, this is a spokesperson from the Ministry of Foreign Affairs in Mexico, really acknowledging that they had expected their chancellor to announce a gender-focused policy, not a feminist foreign policy. Even though civil society weren't necessarily calling for explicitly feminist foreign policies, they were conducting advocacy that created a soft landing ground, an enabling environment for these kinds of policy announcements to come about. So this was acknowledged both by civil society representatives, but also people from inside government, as you can see from the quotes here in relation to Sweden, talking about the way that advocacy from feminist movements over decades really created an enabling environment for Margot Wallström to announce that first feminist foreign policy in 2014. The next finding is that the announcements were really closely linked to the personal values of the individual making the decision, rather than necessarily the government as a whole. So a good example of this is Mexico. Mexico is not generally viewed as a country which is particularly progressive on gender equality. And there are obviously some really serious challenges for women living in Mexico, particularly extremely high rates of femicide with a lot of impunity for perpetrators. However, the Mexican Foreign Secretary, Marcelo Ebrard, was formerly the mayor of Mexico City, which does have a number of really progressive policies. For example, marriage equality, which they brought in long before Australia, and abortion, which is really significant in a Catholic country. So he really brought that personal commitment to gender equality into his role as Foreign Secretary. The next factor was that feminist foreign policy announcements are often driven by the need for some kind of announceable, and often that was a negative driver. So domestic pressures on other gender issues, for example, the sexual misconduct scandals in the UK charity sector, and the Me Too movement, putting pressure on political figures in France, were really pointed to as factors that were a driver for those announcements of feminist foreign policy, or in the case of the UK Labour Party, feminist aid policy. And finally, the opportunity for countries to really make a splash on the world stage was another driving factor. So Sweden's feminist foreign policy came about when they were bidding to sit on the UN Security Council. France was hosting the G7. Mexico made their announcement when they were named as the co-host of the Generation Equality Forum. And speaking of generation equality, it's I have to claim some credit for IWDA in securing feminist foreign policy as one of the potential commitments for governments to make under Action Coalition 6, which we've just seen taken up by Libya. I'm not going to claim that announcement, but certainly we were successful in securing that as one of the potential commitments. So it's been really exciting to see that international process that's happening as we speak this week enable the greater uptake of feminist foreign policy. Okay, so I'm going all right for time. I have made some calls about where I'm going to focus in order to keep this to 15 minutes. So I'm going to skip a little lightly over this section, which is on the factors that were important in terms of developing the actual policies that go behind these announcements. So when a minister goes out, surprises everyone with a feminist foreign policy, and then there's that scramble to figure out, well, what does this actually mean in practice? The thing I'll say is that the role of civil society was really clear here in holding governments accountable to those commitments. And quite a few interviewees thought that it, not without its risks, but that it can be quite an effective strategy, get the commitment in place and then work out what it means and do that accountability afterwards. So I want to just focus on the future trajectories for feminist foreign policy. So there were really mixed views among the people we spoke to about whether we're going to see more feminist foreign policies, sort of a snowballing effect, more and more countries getting on board, or whether this is sort of a unique moment in time. So COVID was a big focus, obviously, in that. Some people really felt that it could be a critical juncture, making people more aware of the fact that existing systems aren't working, particularly for the most marginalised, and that we need really radically different approaches, and that we could see more appetite for that going forward. But then other people worrying that feminist approaches will be seen as something that you do when the sun is shining, but falling back on old ways when times get tough. There was also a debate about whether more countries adopting feminist foreign policies will make it more or less attractive for others in the future. So, on the one hand, as more nations do it, it becomes less risky, more normalized for the next one to come on board. There's also more opportunity to shape what feminist foreign policy looks like. I mentioned there's not a strong global consensus, although, we and many others have been doing that work to try and build a global definition and a benchmark. But, coming on early means there's more opportunity to shape it and be part of that process as a government, really be leading the world in that way. On the other hand, the more countries that get on board, those accolades start to diminish. It's less unique. It sets you apart to a lesser degree. And maybe you have less opportunity to shape it. You're more of a follower. So I think the two quotes here up on the screen really sort of illustrate that paradox. Okay, so the $1 million question is, what does this mean for advocates in Australia? and for political actors who might be weighing up the pros and cons of going down this path. So I think the biggest lesson here for politicians is don't ask for permission, ask for forgiveness. Lead from the front, be bold, make an announcement, and then deal with the fallout. So I think in Australia, for us to get a feminist foreign policy here, what we would need to see is a really bold leader who's willing to go out on a limb and expend some political capital. We're not being naive, I think there would be some backlash to deal with. But I think, it might light up talkback radio for a couple of days, but ultimately foreign policy is a long way down the list of what most Australians really think about when they go to the ballot box. They're not thinking about the intricacies of foreign policy. They're thinking about issues much closer to home. And so a smart leader could really take advantage of that apathy, ignore the opposition, assume that the apathetic will just kind of carry on with their lives after a couple of days, and really count on, a supportive progressive movement to back up the announcement. For advocates, I think it means that we need to think a bit differently about our approach. Working through kind of traditional policy processes might not be as effective for something like this, where, actually nurturing relationships with progressive politicians who either hold power now or might hold power in the future might be more likely to get us to the kinds of announcements we'd want to see. And, this is a bit counterintuitive to feminist approaches, which tend to be more collaborative and process oriented when they're working within the system, or really activist and adversarial when working from outside the system to apply pressure. So I think it's a challenge to feminist advocates to think about our approach. And I've just slipped in one final quote, which I just want to touch on as I conclude, which is that a really big debate is about whether or not it matters if you call your policy feminist, or if you could effectively implement a transformative gender-focused foreign policy without needing to use the F word. And I really understand the instinct here. It's something I've been open to in the past, but I think for us, this research process really solidified our personal views and our organizational position that, if you're not bold enough to call it feminist, are you really going to be bold enough to implement it in practice? Feminist foreign policy should be transformative. It should be challenging. It should be, a really comprehensive and holistic transformation of your approach. And so if you're not bold enough to use the label, I think for me, it really raises questions about whether you'd be bold enough to implement it in practice. So I'll leave you with that thought, and really happy to take questions.
Thanks so much, Alice. That is a pretty powerful quote to finish up on. Before I introduce the next speaker, I'd just like to let everybody know we'll be doing questions at the end. So please do start sending them through, and I'll be directing them to whomever you'd like to ask the question to. So just drop them in the Q&A box. And those of you joining us from the Hoover app will be feeding those questions through. So please do begin to send them through. We've got lots of interesting panelists, and there's lots of questions to be asked, no doubt. So I'd like to introduce Rachael Diprose from the University of Melbourne. Rachael's a senior lecturer in the School of Social and Political Sciences and the Faculty of Arts at the Uni of Melbourne. She also teaches the Master of Development Studies program. Today, Rachael will be chatting to us about gender, power and decentralised governance, women's networked collective action and influence on development in rural Indonesia. Thank you so much, Rachael.
Thanks very much, everybody. It's great to be here. Before I begin, I wanted to acknowledge that I'm coming to you from the lands of the Wurundjeri people in the Kulin Nations, and acknowledge their elders past, present and emerging, and recognise that this is land that was never ceded. I'll just share my screen. So today I wanted to talk to you about our research that's been ongoing in Indonesia for the past couple of years. And before I begin, to make sure I've got sufficient time, I wanted to just hone in on some core arguments that I wanted to discuss in this presentation. The first is that what I'm going to be talking about is the way that grassroots women, particularly poor and sometimes quite marginalised women in rural Indonesia, have been able to, despite the barriers that there are to gender inclusion, have some influence on governance and development and structures of power in rural areas through a process that we call Women's Networked Collective Action. And this is the way that women from these groups have managed to garner support both from each other and from other actors to collectively influence change. And I also wanted to talk to you about the role of civil society organisations in this process and how, particularly for marginalised groups, they can take on a really strong brokerage role in connecting women to the state and helping them to navigate barriers to gender inclusion in the ways that they also get involved in negotiating with the state and other powerful actors, what we call negotiated spaces. So there are 2 points that I want to make that are sort of threaded throughout this presentation. So the research that we've been doing has been conducted right throughout Indonesia. We predominantly did this research in 2019 and leading into 2020. Lucky to just get our first very large round of data collection finalised just before the pandemic hit. However, we also, during the pandemic, have gone back through various mechanisms to talk to people in a proportion of the villages that we conducted this research around how women have been faring, particularly marginalised women and very poor women in COVID-19. So overall, we've spoken to more than 600 people initially and another 120 interviews after that. And in our more recent round of research on the COVID impacts, we've conducted a survey of 600 people. And we've worked with both the endorsement and support of 15 very large civil society organisations across the archipelago for this research. And it's been a collaboration between the University of Melbourne and the University of Gajah Mada. And what we were trying to understand was in what contexts and to what extent and through what mechanisms, and this is really important, we're very interested in pathways. How do you influence change to be more gender inclusive so that women have a role in influencing village development and outcomes for their own well-being, and what's been the role for CSOs in this process. And it's this, I'm representing the research of a large team and very long village stays and a lot of thousands and thousands of hours of work over the last few years. So the first key point that I want to note is that Indonesia's governance structures were already decentralised over the last 2 decades. But in 2014, Indonesia introduced a fairly radical law called the Village Law, which devolved even more fiscal and some decision-making authority to rural villages. 75,000 villages now get an annual budget of somewhere in the vicinity of $100,000 US, which is an enormous change. They can introduce policies and make decisions around small-scale development initiatives for their villages and also some service initiatives. So there's still large government centrally and regionally instituted policies and programs and service provision, but there's also a very significant role now for villages to make autonomous decisions in that space. It's an enormous change. As you can imagine, that has huge political implications, but also raises questions around to what extent these processes are gender inclusive. And one of the core findings from our research, which I'll present some more on in a minute, is that when women are involved, so across all those regions that I showed you where we were doing research in all manner of local, cultural and administrative contexts, in densely populated areas, in lightly populated areas, in far-flung parts of the country, in places that were a bit more closer to urban centres, across these really diverse economic, geographic, socially diverse contexts, we did find that when women were involved in decision-making and better incorporated into the local structures of power, and particularly with the support of civil society organisations, you got a greater diversity of development outcomes in these spaces. So there has been a propensity for in the first 5 or 6 years of the implementation of this law towards infrastructure. And that's there's a long history of that in Indonesia. But in this instance, we got a greater diversity of outcomes. We saw focus on, diverse livelihood support, new types of services, new regulations on ensuring women participate in decision making or allocating funds to particular activities conducted by women's groups. We saw things like village ambulances being introduced, which are particularly important now with COVID raging, solar power, electricity, a whole range of different things. And that was less likely in other places that sort of hadn't had this kind of these sorts of interventions and support. And that's evidenced by larger studies and surveys done by the World Bank and others. So the question is, what are women up against? How inclusive are the processes already? What sort of changes are happening? And what we need to note is, there has been some reasonable steps policy-wise and through a lot of grassroots and collective action and social movements in Indonesia to shift the policy context to give greater attention to gender nationally. Indonesia is very concerned with the Sustainable Development Goals. The UN notes that in 2018, Indonesia had achieved a medium degree of gender equality. And there's been, greater attention to rights and so on, but there's a lot of variation in how this plays out on the ground, and particularly a lot more work to do in rural areas. A lot of those impacts are organised and felt much more in urban areas. And what we found with our research is that when you're coming in with the lens of gender inclusion and women's empowerment, there's an enormous amount of diversity across the archipelago in these rural contexts. And that was very evident in not only in interviews, but our long village stays and multiple different sources of data collection, which took into account existing policies and institutions, how inclusive they were, the nature of leadership, how involved women were in this, political willingness to take on the agenda of empowerment and gender inclusion, the extent to which there were champions in these spaces, how much policy and programming and investment in well-being and social services and so on was paying attention to women's needs and their self-determined priorities, as well as the sorts of gendered social norms, cultural taboos in this space that exist, and how extensive and diverse social networks were. So you can see from across all of our research sites, there was quite a degree of diversity as sort of a starting point at the point of which this village law was introduced. So this is what women are up against, but to varied degrees across the spaces that we were investigating. And a real challenge for women was many sorts of more invisible barriers in norms and practice. So despite the fact that there might be rules and policies which are looking to improve gender inclusion, there's a lot of social norms around exclusion, particularly in the role of women in public life and in decision making. And as women take on the agenda of trying to participate in those spaces and have more influence in those spaces, they encounter an enormous amount of stigma and resistance, particularly from authoritative actors. It's variable in all our different research places, but there's also a significant amount of fear and sometimes threats that women encounter. So they're in a high-risk situation to take on this agenda and push those norms to get more involved. And there's a policy lesson in this for people thinking about what do we do to support women, and it was very clear from the research that changing the rules to sort of force participation, it's really important with gender quotas and so on, but it's insufficient to tackle the sorts of challenges that women face. And as we can see as one woman, this is echoed by many of the people that we interviewed. It's really hard for them. They have to sort of dig deep for a lot of courage. There's a lot of fear in encountering officials saying the wrong thing, fear of police. There's sort of an overhang of many years of authoritarianism in Indonesia, albeit some decades ago now. And so how do they sort of tackle these sorts of intrinsic and more overt challenges that they encounter? And we found that through a variety of mechanisms, which I'll show you in a moment, that with collective action of women in these rural areas and with CSO support in all the research villages where those different types of civil society organisations, a very specific type of civil society organisation that put gender inclusion and women's empowerment at the forefront of their agenda. There's obviously enormous variety in the civil society organisations in Indonesia and elsewhere, but in those that are concerned with this issue, when women and they worked together with women and women themselves took on this agenda, that we did see changes over time, but we didn't see these in places where there was no sort of support for women to counter those sorts of challenges that I was talking about. So how did they do it? Well, the first thing to note is that change in rural Indonesia isn't a process of huge demonstrations on the streets that you might see in places like Jakarta. And that's obviously been a really important part of influencing broad-based policy change at the national level, but that's not what you see in rural Indonesia. In rural Indonesia, change is much smaller and incremental, and the ways that women undertake collective action is often through women's groups and through often much more informal and less confrontational processes. And here we have to remember that, you know, women are in rural areas, live in very tight-knit communities with very close social networks where everybody knows everyone. And the implications, given those risks for women of them taking a confrontational approach, it has huge risks for them in terms of losing livelihood support, losing social networks and being socially excluded. So this is the forms that women's collective action has proven to be influential. And what we found was that in these very, very varied district and village contexts with all sorts of types of existing and sometimes new collectivities and groups for women, huge amount of variation, there were three sort of common pathways which we found were influential in creating change for women. Through both building, women building their own agency and collective action, particularly through women's groups, they were growing, both sharing and creating a sense of solidarity, but also growing their own power. And civil society organisations of all different structures and forms of support also not only supported that process through helping to build skills and knowledge and networks, practicing public speaking and so on, together local women's groups with this sort of some external support sort of began to have influence in development and greater participation in decision making for women. But CSOs also took on their own advocacy strategies at higher levels to help break down some of those barriers for women. And we found that through these three interrelated and intersecting pathways, we saw changes, those sorts of changes that I mentioned before, in both the rules, the institutions, the small regulations that villages introduce to govern how the village will run. Some of them were gender inclusion policies, allocation of funding for women's groups and so on. There was slow and incremental shifts in social norms. It's a much slower process, but some of the taboos around gender inclusion started to be reduced, and there was funding allocation. And over time, this affected the broader context as well. It became, these places became, albeit to different degrees, more gender inclusive. And this was happening through many different forms of intersecting collective action, informal everyday engagement, lobbying, leaders and other authoritative actors, as well as participating in meetings and forums and task forces and so on. and so these processes were interrelated. And so what we found was that through informal spaces, women slowly built friendships and relationships and grew their support for each other. And this was consolidated through women's groups. And this, together with these groups, participants in these groups were then able to build relationships in everyday settings with other authoritative and influential social and political actors, people on the local council, the village head, and others. So if there were resistant actors who were decision makers, women would lobby informally other actors close to those decision makers, and then together they would create multiple sources of pressure on the village government and other influential actors to create change. In this instance, this led to cross-stakeholder collaboration by both the women, led by the women's group, but with participation of other village figures. And we saw a whole heap of new decisions, allocation of funding around preventing violence against women, as well as responding to cases of domestic and other forms of violence. So key to this process was building and strengthening networks of trust, first with other women, a very horizontal process, then with other community members, often through everyday engagement within the village, not always in very formal forums, then leveraging these newly established or existing networks to garner broader support and overcome some of the barriers that they created. And this important in this process were both formal and informal spaces for women. And we found that another argument that I make is civil society organisations were key in this process via three mechanisms. They helped negotiate spaces for women, particularly with state decision-making forums when they were restrictive for women. They'd bring women together in organised groups and do some of that skills work and capacity work and help extend their networks. And this was particularly important in really restrictive contexts. So we found that this was very important, and I'll just make a couple of points and wrap up, that this wasn't a linear process upwardly. Everything got better over time. There were ebbs and flows, and particularly at critical junctures around elections, disasters, like we're seeing now with the pandemic, where things could regress. And we can see this in one of the cases that I've presented. And in the case of COVID, it's presented a critical juncture where all of that hard work over the last 7 to 8 years in some of these places has the potential to slide. But what's been really interesting is that, in the first tranches of cash transfers for women, particularly because of the work of PECA, which is the Union of Female-Headed Households, there'd been so much visibility and connection to these formal governance spaces in these quite remote areas that female-headed households, one of the most stigmatised and marginalised groups in Indonesia, were one of the biggest groups to get the first tranche of village dispersed cash transfers out of the village fund. Women were more likely to know about things like the President's Fund for Small Business as a part of the COVID response. They're in places where informal workers had been organised. They were able to pivot their livelihoods that were severely disrupted by the pandemic to new livelihoods that could be undertaken during the pandemic in ways that other women who weren't organised weren't able to do. And we found that they were also more likely to attend meetings where decisions were made if they had prior CSO support. And we can see from this that, the coping strategies in men and women in terms of increasing their spending, reduced income and so on was pretty similar, but it was men that were more likely to lose jobs and take on more of a larger proportion of them took on more of the childcare responsibilities. But in the decision-making task forces, there was a bit of backsliding. These were often allocated by your official position in the village, so there was far fewer women on the COVID task forces at the village level than there were men. And there were problems of greater domestic violence. We had some qualitative evidence on this, but the Komnas Perempuan, one of the large women's organisations, had found that with broader data. I'll stop there, but I just wanted to share that a lot of this research in videos and interactive forms can be found on our website in both languages for anyone that's both from Indonesia or from other countries. Thank you.
Thank you so much, Rachel. Well, we've got a short period of time for questions, but I see quite a few have come through. So I will quickly get started. So I can see there's a few upvotes for one. So there is a question here for the panelists from Leanne Smith. Hi, Leanne. Interested to hear the panelists' views on how Australia would take a feminist foreign policy approach now to the current and emerging crisis facing our sisters in Afghanistan in the context of our recent military withdrawal. Perhaps, Alice, did you want to kick us off with a response to that?
Sure, and thanks for the question, Leanne. I think it's a really great example of one of the risks of not having a feminist foreign policy in place is that we're in this situation that you describe where, Australia is withdrawing military from Afghanistan after many, many years without, seemingly without regard for the implications that will have for women in Afghanistan. And, I think it's, if we'd had a feminist foreign policy in place back in the early 2000s, we'd have to ask, would we really be in this situation? I think it would have influenced, changed a lot of those decisions over that period of time. But yeah, I think it's a really great example of the ways in which our current approaches to foreign policy are failing to address the implications for women and girls. And I think that would look very different if we had a feminist foreign policy in place.
Thanks, Alice. I'm just conscious of time, but that was a pretty thorough response. But I would like to actually direct a question now to Wang. Thank you, Anita, Wang and Tiffany. Gender equality is important, but very sensitive topic in Asia Pacific countries. How can we engage with local communities and address this issue with respecting the local culture and history? Wang, would you like to respond to this one?
Yes, yeah. I think, first of all, you have to build trust, a good relationship with the local government stakeholders, and also do not go straight to gender equity when you talk about it, but from a suitable entry point, for example, iHealth, start from that, and also try not to challenge their work that they did not do a good job with gender equity instead, but say we will try to understand the barriers and the difficulty facing for women and girls to access eye health, and then we work together to increase accessibility for women and girls. And yeah, that will be a good start. Then gradually you start eye health, with gender equity, gender awareness. We say gender awareness instead in gender inequity. That's what the lessons we learned in Chinese context. Yeah, I hope this help.
Thank you, Wang. Actually, to piggyback on that question, there is one from another attendee, and this is following in the same vein, I think. Perhaps I might direct this one to Rachael, but also please feel free to jump in, other panelists following this. We do have an extra 5 minutes, I've been told. How can gender equality coexist with traditions? For example, there are festivals and spiritual places which traditionally women are not allowed to join or enter. Are these things considered as gender inequality? And do you think these traditions need to be changed?
Well, this does relate to the previous question, and I was nodding a lot as Jing, I hope I've pronounced that correctly, was speaking. I absolutely agree. A lot of the work in the most difficult, I guess that's a loosely used word, places where we research, you don't come in with a confrontational gender equality. We're tackling all these cultural book taboos and social norms. that we disagree with. A lot of the work was slow and incremental in convincing local power holders that this process benefits everybody. And so a lot of the strategies used in those spaces was to build trust first, work on activities that were beneficial for the broader community. We saw things like documentation of mass marriages that had been unofficial. Everybody was benefiting. And then slowly in building trust, you can start to talk about some of these more culturally, or not only culturally, but more sensitive issues. But that was, you wouldn't find women or men in their spaces saying, I must have a role in this cultural ceremony. These are more about social and economic and political exclusion, that they can coexist. There's plenty of recognition of local traditions and customs by civil society organisations and women. It's more about bringing women into the spaces where important decisions for everybody are made, and ensuring that they get to have a say too.
Thanks, Rachel. Any of the other panelists want to add on to that before I ask the final question?
I just add something quickly. I think that last point that you made, Rachel, really touches on the critical thing to me, which is about power. So, you know, it's fine to have safe spaces for women and spaces for men, but if those are the spaces where all the power is held, where all the decisions get made for a community, I think that's when it becomes a problem for gender inequality. So, you know, being able to see the difference between, you know, just a community tradition or a space for women or for men as compared to a decision-making space that people are excluded from. I think that's the critical thing to understand.
Yes, most certainly. There is another question which also, I guess, actually does relate to what you've all been saying. But there's a question here from another attendee who has said that some of my male friends are concerned that promoting gender equality and feminism may lead to gender inequality towards males. I would like to hear your opinions. Thank you. And we hear this a lot in Australia as well. This is quite a common trope, if you were, but at the same time, you know, people have their valid concerns, and I'm really curious, like the person who asked the question, what do you as panelists feel about addressing these concerns from men who somehow feel that the pendulum will swing back against them, and what that would look like? Anyone feel free to jump in. Anita, perhaps.
Yeah, I'll just jump in quickly, I guess, because it is, and I guess it kind of speaks to the different context in which we are working. And I think what Wang was saying about that trust and the partnerships, and I guess it's about bringing everybody along on the journey. And like a bit like Rachel said, it's about creating if I relate it to eye health, we're creating a referral pathway that benefits everybody, and that everybody's got better access to eye health services. And just because you are, you know, looking at one particular group of people, if we're looking at ensuring that referral pathway is enhanced for women, it also enhances it for everybody as well. And that, you know, everybody kind of benefits from, and showing, I guess, our male counterparts and colleagues that everybody benefits more from if we're all involved, if we've all got a seat at the table, if diverse voices are being heard and part of decision making. And we've seen that play out in COVID as well, where there's you know, decision making bodies that have more of a mix of diversity are doing better than others. So I think it's, yeah, really showing those examples and bringing people along, and that informal confrontation, I think someone said, is really important as well.
If I can just add to that, yeah, I think, you know, again, focusing on the ways that patriarchy harms men as well. So, you know, under patriarchal systems, men miss out on relationships with their children, on, you know, telling their friends that they love them, on, you know, experiencing emotions in a fulsome way, you know, those are real harms that patriarchy causes men at the moment. So it's not just that men, you know, benefit more under the current system. There's also some really serious ways that it holds men back or harms them from leading full lives. And I think emphasizing the way that gender equality is going to benefit all of us, again, is really, you know, I think the really critical way to get people on board.
Thanks, Alice. Look, I just wanted to, we have to wrap up, I'm afraid, but I just want to say thanks to all our panelists. I think it's a really good note to finish on, and a hopeful and optimistic note as well. Thank you to Tiffany, Anita, Wang, Alice, and Rachel, and all of the attendees who've joined us for this session. I hope you all took away something interesting. I know I certainly did. I see that Alice dropped the link for some work with IWDA. This session has been recorded, but of course, please use the Hoover app to share any ideas, share chats, share links. I encourage all of you to check out each other's research and websites of all the different organisations, Fred Hollows, University of Melbourne, etc. Thank you all again, panelists, and enjoy the rest of the conference. And we'll close it up now. Thank you.
Thanks, everyone.
Thank you.
Thank you.
Thank you. Have a good day.